Ready? Okay, there are two types of blood lipids. There is cholesterol and triglycerides. Okay, the desirable ranges for cholesterol overall is less than 200. LDL is less than 100, and HDL is greater than 50 to 60. Cholesterol is made in the liver and intestines. LDL carries the cholesterol to the peripheral tissues, and HDL carries the cholesterol to the liver for excretion.
So it indicates muscle mass.
If LDL is high, there's an increase for CVD, and if HDL is high, it protects against CVD. Cholesterol increases with increased fat, increased cholesterol in the diet, uncontrolled diabetes, and biliary cirrhosis. Cholesterol decreases with malnutrition, malabsorption, and liver disease. Triglyceride desirable range is less than 150. Triglycerides increase with high cholesterol, uncontrolled diabetes, alcoholic cirrhosis, and pancreatitis. Triglycerides decrease with malnutrition and malabsorption. Triglycerides are transported by VLDL and LDL. Increased triglycerides greater than 1,000 can result in pancreatitis.
Blood sugar and hemoglobin A1C, both methods of measuring blood glucose levels in diabetics. Blood sugar is one of the main ways to detect glucose levels. The normal range is 70 to 100. It can be increased with uncontrolled diabetes, dehydration. It's an acute stress response, so it will go up with stress or infection. It's also increased with steroids, pancreatitis, and Cushing's syndrome. It decreases with too much insulin, overhydration, liver disease, and endocrine disorders. Smoking can also increase your blood sugar. Hemoglobin A1C is a good way to see how the blood sugars have been in the past 3 to 4 months in diabetics. It's increased with newly diagnosed or poorly controlled diabetics, and it decreases with sickle cell anemia because of the increased red blood cell turnover. Normal for healthy range people is 4 to 6%, and with diabetics it's good to be below or equal to 7%. It measures the percent of hemoglobin that's bound to glucose. And something important to remember would be the DCCT, which is the Diabetes Control and Complication Trials. It was a landmark study that studied high glucose causes of complications of diabetes. It was a trial of type 1 diabetics and lasted 7 years. The intensive treatment group had a 60% reduction in risk of retinopathy, neuropathy, and nephropathy. Thanks.